Hello and welcome to today's episode. If you've ever heard of Group B Streptococci, or GBS, you might know that it's a topic closely related to pregnancy and newborn health. But what exactly is GBS? Why is it so important, and why should we be aware of it, especially if you're pregnant or planning a family? In today's video, we're going to explore everything you need to know about GBS. What it is, how it affects the body, its risks, especially for newborns, and how it can be prevented or treated. Whether you're a concerned parent, expecting a child, or just curious about the subject, this video will provide you with all the information you need. So let's dive in. So what exactly are Group B Streptococci, or GBS for short? GBS are a type of bacteria that naturally lives in the human body. They're commonly found in the intestines, rectum, and vagina. And here's the thing, most people who carry GBS don't even know it. In fact, for many healthy adults, GBS doesn't cause any harm and lives in the body without causing any symptoms. It's just part of the normal bacteria that coexist within us. GBS, however, becomes significant when we talk about pregnancy and newborns. Around 25% of pregnant women carry GBS in their intestines or vaginal tract. It's crucial to note that while it's harmless to most adults, the bacteria can be passed to a baby during childbirth, which can lead to serious health issues. Before we jump into the risks and implications, let's break down some basic biology. GBS is a type of Streptococcus bacterium. It's different from the better-known Streptococcus pyogenes, which causes strep throat. GBS is typically a commensal bacterium, meaning it can live in harmony with its human host. However, under certain circumstances, GBS can invade the bloodstream or tissues and cause infections, especially in vulnerable populations, like newborns. Now, you might be wondering, just how common is GBS? As I mentioned earlier, around 25% of women carry GBS in their bodies, particularly in the genital or rectal areas. This means that for every 4 women, one is likely to be carrying GBS at any given time. For these women, GBS typically doesn't cause any symptoms, which is why most women don't even know they have it. The bacteria can come and go in the body, meaning that you might test positive for GBS at one point in time and then test negative later. The key factor to keep in mind here is that GBS isn't considered a sexually transmitted infection, STI, and it's not something that you can actively prevent by using condoms or other protective methods. It's simply a part of your body's natural bacterial flora. The challenge arises when GBS is present during pregnancy, particularly during delivery. So why is GBS such a concern during pregnancy? The main risk with GBS during pregnancy is that the bacteria can be passed to the baby during childbirth. This happens when the baby comes into contact with the bacteria as it passes through the birth canal. When GBS is transmitted to a newborn, it can cause serious infections. And this is where things get a bit complicated. There are 2 main types of GBS infections in newborns: early onset GBS infection. This occurs within the first week of life, usually within the first 24 to 48 hours after birth. In early onset cases, the baby contracts the bacteria during delivery. GBS can cause sepsis, a blood infection, pneumonia, and in some cases, meningitis, an infection of the fluid and lining around the brain and spinal cord. All of these conditions are serious and require immediate medical attention. Late onset GBS infection. This typically happens between 1 week and 3 months after birth. The source of late onset GBS isn't always clear, and it might not always come from the mother during delivery. This form of infection is more likely to cause meningitis, which can lead to long-term complications like hearing loss, vision problems, or developmental delays. The thought of any infection in a newborn is concerning, but it's important to remember that not every baby born to a GBS-positive mother will become infected. However, the risk is significant enough that screening and prevention are a major focus in prenatal care. Thankfully, we have ways to reduce the risks associated with GBS during pregnancy. In many countries, routine GBS screening is recommended for all pregnant women between the 35th and 37th week of pregnancy. This screening involves a simple swab test where a sample is taken from the vagina and rectum. The test is painless, quick, and provides crucial GBS. This doesn't mean there's an immediate danger to her or the baby. It just means that precautions need to be taken during labor to prevent the baby from becoming infected. The most common prevention method is administering intravenous (IV) antibiotics to the mother during labor. Penicillin is the antibiotic most commonly used, but if a mother is allergic, there are alternatives available. The antibiotics work by killing the GBS bacteria in the birth canal, which dramatically reduces the risk of passing the infection to the baby. Research shows that giving antibiotics during labor can reduce the risk of early onset GBS infection by up to 80%. If you test positive for GBS, it's important to know that the antibiotics are only needed during labor, not before. This is because the bacteria can regrow in the body, so treatment earlier in pregnancy wouldn't be effective at the time of delivery. But what if the baby does contract GBS despite the precautions? If a baby shows signs of a GBS infection, they'll be closely monitored and treated immediately, typically in a neonatal intensive care unit, NICU. The symptoms of early onset GBS can include breathing problems or irregular breathing, abnormal temperature, either too high or too low, feeding difficulties, lethargy or irritability. If a doctor suspects GBS, they'll take blood samples and sometimes spinal fluid samples to confirm the infection. Treatment for a GBS infection usually involves IV antibiotics, just like with the mother during labor. Babies who are treated quickly for GBS generally recover well, especially if the infection is caught early. However, if the infection leads to complications like pneumonia, sepsis, or meningitis, the recovery process can be more complicated. In some cases, GBS infections can result in long-term health issues, particularly if the baby develops meningitis. These long-term effects can include developmental delays, hearing loss, or even cerebral palsy in severe cases. While GBS is most commonly associated with newborn infections, it's important to remember that it can cause illness in other populations as well. The elderly, particularly those with chronic illnesses like diabetes, heart disease, or cancer, are at a higher risk of developing serious GBS infections. People with weakened immune systems, including those undergoing chemotherapy or living with HIV, are also more vulnerable. In these cases, GBS can cause invasive infections like sepsis, pneumonia, and bone or joint infections. Treatment typically involves antibiotics, just like in newborns, but the outcome depends on the individual's overall health and how quickly the infection is treated. To wrap things up, GBS is a common bacterium that many people carry without even knowing it. While it's usually harmless in adults, it can pose a serious risk to newborns during childbirth. Luckily, with routine screening and preventive measures like antibiotics during labor, we can significantly reduce the risk of infection. If you're pregnant or planning to start a family, be sure to talk to your healthcare provider about GBS screening. And remember, GBS